one of the benefit of breastfeeding is giving optimum support to maximum mean best support to the infant's growth. Second, the child's intellectual development. Okay. Third one, a relationship is created between the foster mother. Foster mother means anyone who is feeding the infant the milk is a foster mother. Understood? Understood?
Yes, sir.
The feeding mother doesn't need to be its own biological mother, but normally that is what's happening. Understood? The one who is feeding her, she is the mother. Who is bringing up the child. Right. Second, it is so first the mother and infant are developing a relationship. The first dependency for the child is on the mother is the breastfeeding. And that is the beginning of a very long relationship. Till we have that relationship with our mother mean it started when she gave us milk. Correct?
Yes.
That is the relationship still we continue. So it's a prolonged relationship starts in a single point. Okay, now say there are working women are there. So what they do? They have a breast pump. They will pump the milk into a bottle and ask the servant to feed the infant in the correct time, and they go for the work. Here, mother-infant relationship will not be established. That child will be taking that lady who is giving the milk as its mother. Understood?
Yes, sir.
Right. Like this, breastfeeding has several benefits. Nowadays, in our country, okay, we are giving the children powder milk, correct?
Yes, sir.
Powder milk. And so many infant related, formulated according to the infant powders are there, but all of them have basically cow milk there. It's not human milk in the powder form. It is the cow's milk in the, what is it? Powder form. How human milk is better than cow milk? It is the one pointed to you here. One thing they say in the breast milk, these components are in a readily absorbable, readily metabolizable state compared to, what is it? Cow milk. Second thing it is, this is one of the key point they tell, in the breast milk, what about the sodium level? What about the sodium level?
Low, sir.
Low. Low sodium level is considered as a significant feature. Reason, the infant kidneys are not able to handle high sodium. Understood?
Yes, sir.
Infant kidneys are not able to handle, what is it? High sodium. So, in the cow milk, comparatively, sodium level is high. Third, it is in some children, okay, allergic reactions are developed when they get, the cow milk. Some infants, they don't give a positive response to cow's milk. Clear?
Clear, sir.
Right. Thereafter, we come to the heading called, birth control methods. In the case of birth control, with an intention, if we prevent the occurrence of pregnancy, that is called birth control. There are various social, medical, reasons for performing birth control. Social reasons are there, economical reasons are there, health reasons are there, many reasons are there for birth control. It is commonly called by the name contraception, not allowing to conceive. Understood? In the
Yes, sir.
contraception methods, I will later come to this. In the contraception methods, several ideas are there. One of the idea is, oral contraceptive. If you take oral contraceptives, it's a temporary method. Or giving oral contraceptive will be what kind of method? A temporary prevention of pregnancy. Through oral contraceptive, we can't prevent permanently that one, but in long term we can continue that. This is what we call, people call it Mituri, a Sri Lankan used oral contraceptive. Here there will be 21 tablets having progesterone and estrogen. Daily, the woman has to take one. At the 21st day, she has to stop taking it. Then another 7 days, she should not take the tablet. All those 21 days in her body, progesterone level will be, estrogen level will be high. Understood?
Yes, sir.
Progesterone level and high estrogen level and high progesterone level will be inhibiting the hypothalamus. GnRH release will be reduced. GnRH release will be inhibited. If GnRH is not released, FSH, LH will not be released. Correct? In
Yes.
FSH and LH, if they are not released, ovulation, growth of the follicles, like things. So if the follicles grow only, they can be ovulated. So those things are inhibited. That means no more chance for, the pregnancy. Clear?
Yes, sir.
Right. Nowadays, there is a same or in oral contraceptive in the market. If you go for oral contraceptive, there are different oral contraceptives there. Now, what is available in Sri Lanka? It will have progesterone and estrogen in the equal level. So that means this tablet and this tablet and this tablet and this tablet have equal levels of progesterone. Some oral contraceptive will be there. First 7 days a low dose, second 7 days little more higher dose, third 7 day another little more higher dose. That kind of ones are there. Some oral contraceptives there's no progesterone and estrogen. Instead, a synthetic progesterone called progestin will be there. but outcome is same. Understood?
Yes, sir.
Right. So suppose if fertilization occur after giving this, it interfere the implantation, not allowing to the embryo to get implanted. If the embryo doesn't get implanted, then no child will be formed. Understood?
Yes, sir.
Good. So please go through the oral contraceptive and tell me whether things are clear.
Yes, sir.
Yeah. Shall we move? Now we are coming for the heading. What's it? Condom. Condom is a latex material worn by the males. Okay. It's a latex material worn by the males. Okay. The semen released will be collected in the condoms and will not enter the female reproductive system. Understood?
Yes, sir.
Understood? The
Yes, sir.
semen released will be collected in the condom and it will not added to the female reproductive system, and that prevents sperm entry to the female reproductive system. So no chance of fertilization. Next it is a loop. What is the name of that loop?
IUD.
IUD. IUD is applied for whom? Females. Okay. If you take IUD, IUD loop. Okay, it's a T-shaped structure. This is the size of, what is it, IUD. You can see how much small it is, correct? And it is placed inside the uterus in this way. Can you understand how the T is placed there?
Yes, sir.
Yes. This one, if it is placed, mainly interferes the fertilization and prevent the implantation. Okay, according to the medicinal medical doctors, this is one of the most successful methods of, what is it, prevention of pregnancy, but none of the methods are 100% sure. Clear?
Yes, sir.
Right. Another one is an injection. It's a diffusion injection. It says several health issues are getting created by this injection. It is called Depo-Provera. What is it? Injection. Okay. In that one is a contraceptive injection. The chemical present in it. Okay. Here. Medroxyprogesterone, like a particular, as normally we can say there's a progestin there. What is it? Simply we can say, what is the material? Progestin there. And taking this injection will make the cervix area mucus to become thicker. Because the cervix area mucus is becoming thicker, sperm will not enter into the uterus. Okay. In most women who are taking Depo-Provera, menstrual cycle is not taking place because cervix is blocked there. It also can prevent implantation by making the endometrium thin. Clear?
Yes, sir.
Right. The next one it is, all these ones I told you are temporary method. If a woman wants to make a child, she can stop this and can go for another pregnancy. Permanent methods are there. Surgical methods are normally taken as, what is it, permanent methods. In that one it is vasectomy. Okay, vasectomy in the male. Okay, what we do is, you can see here, the vas difference is there. No? You know vas difference, right?
Yes, sir.
Vas difference is cut and tight. We cut the vas difference, bend the vas difference, and put a tie mark there. Now what happens? Sperms made in the testis will not travel through the vas difference. So will there be any sperm in his ejaculation?
No,
Will
sir.
there be any sperm in his ejaculation?
No, sir.
No. Okay. So that is a method in males. There's a method in females that is called by the name, what is it? Tubal ligation. Same idea, only one thing. The structure we are cutting is fallopian tube. There it is vas difference. Here it is what? Fallopian tube. Common thing is both cases we cut and tie. Then no chance for the sperm to meet the ovum. Correct?
Yes, sir.
Right. So those ones are coming under surgical method. After surgical methods are completed, you are coming to the heading called, what is it? Abortion. Abortion means Okay. Before, one child has to stay in the uterus for 38 weeks or 40 weeks from the last menstruation, correct?
Yes, sir.
If it is happening in 7 months or 6 months or earlier, so before 9 months, okay, and that is coming under, what is it? Abortion. So what is abortion mean? Premature termination of a pregnancy in progress. There is a pregnancy in progress. Before the pregnancy comes to the maturity, if it is terminated, it is
Abortion.
abortion. In the abortion, there are two types there. One we call, what is it?
Miscarriage.
Miscarriage. Other one we call
Induced abortion.
induced abortion. Miscarriage means naturally due to some problem. Sometimes the girl would have fallen down, understood? Or
Yes, sir.
some physical weakness can be there. Now I know a girl, she was my student. Okay, she was my student. She gets conceived. She is married to one of my relative. He did A levels in 2010 under myself in AL biology. She is married to one of my relative now. Already married 10 years ago. She gets conceived. Okay, she gets conceived. But after 1 month or 1.5 months, she loses the child. Till it continues without a solution. That is called by the name, what is it? Miscarriage. She also takes all the remedies to safeguard the child. She wants a child, but still no answer. Induced abortion, okay, there is okay, with intention, with human intention, I don't want this child. I am going to abort it. With that idea, if a person remove the child from the womb, it is coming under, what is it? Induced abortion. If the pregnancy, if it is the early stages of the pregnancy, then we can go for non-surgical methods using certain, what is it? Drugs. These drugs will be blocking the home.
Progesterone receptors.
Progesterone receptors in the uterus. When progesterone receptors are blocked, response to progesterone will not be there in the uterus. So the uterus will start to contract. The uterus will start to, what is it? Contract. Child will be aborted. But it is possible only within the first 7 weeks. After 7 weeks, now there are instances, in some instances, some women develop uterus cancer during the pregnancy period. Understood?
Yes, sir.
Now the situation is critical. Why? If you allow the child to stay continuously in the uterus, there's a greater chance for cancer to spread. Correct?
Yes, sir.
Then it is going to kill the mother. On the other side, if we remove the fetus will die. Correct?
Yes, sir.
It's a very critical point. In that kind of conditions, even after 7 weeks, it is ethical to remove the fetus to safeguard the life of the mother. Okay, there is certain ethics there. Okay, but we are not here supporting the unethical induced abortion. Understood?
Yes, sir.
Unethical induced abortion is totally wrong. Totally wrong. Okay. So hope you understood it. Correct?
Yes, sir.
Right. Thereafter, this sexually transmitted diseases are given to you. Gonorrhea, syphilis, AIDS, genital herpes, those ones are given to you. This is conducted by a bacterium called Neisseria gonorrhoeae. This is conducted by a bacterium called Treponema, what is it? Pallidum. This is an HIV virus. This is another virus. All these ones have some methods of transmission. All of them have sexual contact transmission. Secondly, mother to child at birth. If mother is a gonorrhea patient, the child will be infected by the gonorrhea when the child is born in this world. That is possible in all of them except genital herpes. Okay. Same time, AIDS can be transferred from use of unsterilized needles. Mainly these drug addicts like people, they are using unsterilized, what is it, needles. Okay, during lactation, milk feeding, one child can get HIV. That kind of things are there. Here you are given lots of symptoms also there. Okay, burning sensation when passing urine, yellow color discharge with pus through the genitourinary tract, gonorrhea symptoms, fever, headache, and actually this part will come to this upper portion. Which portion? This portion is there, no? It is coming to this part. Understood?
Yes, sir.
Source of painless ulcers on any part of the body is a symptom of, what is it? Is a symptom of which disease?
Syphilis.
Syphilis. What is given thereafter only coming for the AIDS? Understood? Fever, skin rashes, loss of appetite, and weight, fever. Okay. Now fever, no need to repeat here, no? Correct?
Yes, sir.
Right. So these parts are actually belonging to whom? Syphilis. These parts are belonging to whom? AIDS. It's a small mistake in the table. But thing is, in Sri Lanka, you know how much we are foolish. This is a mistake in the Sinhala medium resource book. When they, English medium resource book say, when they translated it to Tamil and English, at least they have to correct it now. Correct?
Yes, sir.
In the same place, the same contents are written as it is. Okay. By knowledge only, I can tell what is it. Okay, these ones are not belonging to whom? AIDS. Painless ulcers are not belonging to AIDS. Painless ulcers are belonging to whom?
Syphilis.
Syphilis. So it has been written accidentally here mean it is written in one place accidentally, okay. When you people translate it, will you repeat the same mistake? Mean what kind of attitude is this? That is the one called miharak. Okay, educated people only translate these ones, no? Yeah? Educated people only translate these things. But that is told that way, I don't care. Here I will repeat. That kind of attitude is there. So 8 ones are given to you. Loss of appetite, weight loss, fever, persistent dry cough, lymphoma. Lymphatic nodes are enlarging. That is lymphoma. Lymphoma is enlarging and becoming cancerous. Okay, pneumonia and other diseases resulting from the breakdown of immune system. Last, it is genital herpes. Itchy, painful sores. The painful sores are coming mean herpes. Painless sores are coming mean, what is it?
Herbs.
Painless sores are coming mean?
Syphilis.
Syphilis. Clear?
Yes.
Right. Thereafter, what is the heading given to you?
Detecting disorders during
Detecting disorders during pregnancy. A child developing insight can get several problems. Okay, we have several techniques to find the problems. Okay, one method is what? One
ultrasound
method is
imaging.
what? Ultrasound images. Second method is
Amniocentesis and
amniocentesis and
chorionic villi.
chorionic villi sampling. Third method is pregnant mother's blood analysis. What is the third method? What is the third method?
Pregnant mother's blood analysis.
Blood analysis. In this one, the most common and easier part is ultrasound images, correct? We say ultrasound scanning. Right? In that one, you can see the size of the fetus. Okay, its conditions, its legs, its hands, external things, those things we can normally observe. But using ultrasound images, we can't find out whether there are any genetic disorders there. Understood? We
Yes,
can't
sir.
find out whether the hemophilia is there, whether the color blindness is there, whether albinism is there. That we can't find. In that case, what we do is we will insert a needle to the amniotic fluid, where the needle is reaching. Where the needle is reaching?
Amniotic fluid.
Amniotic fluid. And from the amniotic fluid, when the amniotic fluid is collected, in the amniotic fluid, what will be present? What will be present? What will be present? Roshan,
Yes, sir.
can you hear me?
Yes, sir.
In the amniotic fluid, what will be present?
Fetal cells.
Fetal cells will be present. These fetal cells are subjected to genetical analysis. Through that one, we can find any genetic problem they are in the child. Nowadays, a new method is there. Without sending the needle to the amniotic fluid, we collect the blood sample of the mother. In the blood sample of the mother, what will be present?
Genome of the fetus.
Okay. Genome of the fetus will be there. That can be used to do the genetical analysis. Clear?
Yes, sir.
Right. Remember, among the disorders Some are detectable, some are, what is it? Not detectable. After birth only, some can be detectable. Can we detect all the disorders in the fetus?
No, sir.
No. Among the detectable ones, okay, some can be treated before the birth. Some can be treated after the birth. Some cannot be treated even after the birth. Understood?
Yes, sir.
In that case, the parents will be informed. Your child has this disorder. It cannot be, now for example, thalassemia. Thalassemia, if found, that cannot be treated, no treatment for it. Then the parents will be informed, your child has thalassemia, but it has no medicine, can't cure. Then the parents will be allowed to make a decision whether they are going to continue the pregnancy or not. Understood?
Yes.
Good. So that is regarding that point. Thereafter, infertility. What is infertility mean? Normally, when a male and female get married, they will try to make their child. Next option, next demand from the society and the family will be what?
A child.
A child. Correct?
Yes,
So,
sir.
if they cannot make a child after 1 year, then some kind of infertility problem can be suspected. Understood? That is infertility. Unable to conceive is called infertility. Okay? The present, in the modern society, infertility incidents are, what is it?
Increase.
Increasing due to lifestyle changes, due to food habit changes. Infertility ones are increasing. Infertility problem can occur in both men and women. Understood? Normally, women are the one more treated for this. Not necessary. Men also have equal opportunity to be important. Clear?
Yes, sir.
Some infertility problems are, what is it?
Treatable.
Treatable. Some are not treatable. In that case, first of all, if a couple visits a doctor, are telling that they don't have a child, the doctor's first option will be giving a hormone therapy. Understood? Mainly the girl will be given a hormone therapy. But nowadays, men also should be considered. For men also, there are hormone therapy there. Okay? Hormone therapy given to the males will be increasing the sperm production. Hormone therapy given to the female will make the egg production. Understood?
Yes, sir.
That is the first degree treatment. When we first go to a doctor, doctor is going to first prescribe hormone therapy. There are people for years taking hormone therapy. But certain problems, now most of the time doctor will guess it can be due to a rate and hormonal imbalance. But certain problems are there. For example, in some women, the fallopian tube will be twined, twisted. Understood?
Yes,
Can
sir.
you get my idea? It will be twined. When it is twined, the opportunity for sperm and ovum to meet each other is very low. Then infertility. That kind of problems cannot be solved through hormone therapy, right?
Yes, sir.
Then we go for surgical method. In some instances, everything will be fine, but no fertilization occurring. Okay, in that case, we go for, what is it? Assisted reproductive technology. Clear?
Yes, sir.
In the assisted reproductive technology, there are two methods there. One we call, what is it? IVF, standing for in vitro fertilization. Another method is there, ICSI, intracytoplasmic, what is it? Sperm injection. How many methods?
2 methods.
Two methods. In the IVF, these are the things we do. We remove the oocyte from a, what is it? Female ovary and obtain the sperm or semen from a, what is it? Male, and we mix them together in a petri dish. Oocyte and sperm are performing fertilization under laboratory conditions inside a petri dish. If the fertilization is successful, zygote will be formed or not?
Will be formed, sir.
Okay. We will wait the zygote comes to which cell stage?
8 cell stage.
Thereafter, we will be implanting it in the uterus of the woman. Thereafter, the embryo will continue to develop. Okay, this method is successful in several women. But in some women, fertilization is successful. Implantation, understood?
Yes, sir.
Then only they are thinking of surrogation. Surrogative mothers, understood? Surrogation like things they try. So here to do IVF, we need, what is it? 50 to 100,000 of sperm from the male per one oocyte. Then only one successful fertilization will come. In some males, in the semen, in 1 milliliter, okay, few hundreds only will be there. Are you clear?
Yes, sir.
Okay. In that case, will IVF be a successful method?
No, sir.
No. Here, the sperm has to penetrate the ovum by itself. Understood?
Yes, sir.
That means the sperm should be active. Correct?
Yes, sir.
In some men, sperm activity will be very, very low. That is also a problem. For those problems, we have a solution. What is it? The ICSI. If that is the problem, few sperm count or no more mobility for the sperms, here what we do is we take the sperm nucleus and inject it into the oocyte. Understood?
Yes, sir.
Here one sperm is enough. Though you use 1,000 sperms in IVF, only one sperm is going to enter the oocyte. Correct?
Yes, sir.
Here what we do? Only one. So when if the sperm count is very, very low, or if the mobility is very, very low, then we can go for this method. Anyway, here also after fertilization, after zygote formation, after 8 cell stage, woman's uterus has to accept the embryo. Clear?
Yes, sir.
Right. So with this one, I am completing the which part? Human reproduction. Human reproduction is over. Actually, I'm not much well today. Today class also started late with you. Okay. Fitness is low for me. Okay. Anyway, I have finished. I want to finish this one. I don't want to. Sometimes, I cancel the classes. Okay. Aisha Zeen was calling, asking, sir, do we have class tomorrow? That kind of things are also happening. Okay. So I thought, although my health is not that much fit, okay, let's complete this part. Okay. So now you have another one more portion only to complete the unit number 5. What is that portion?
Support and movement.
Support and movement. Support and movement tute. Here before I have given you.
No, sir.
No, yesterday only I gave you, right?
Yes, sir.
So take the printouts and stay ready, inshallah. Coming week, we will do this work. Okay.
Okay, sir.
Okay. Bye then. Thank you very much. Roshan, I have sent you the MCQ paper.
Yes, sir. I saw. I will
Okay.
send it to
Okay.
you.
Okay. Right.